The VA has a lot of wonderful programs in place. However, we need to really emphasize education amongst primary care physicians so that they have a better understanding of what addiction really is, and deconstruct some of the stereotypes and stigma that I myself carried around with me ever since residency. I think the change in stigma really is going to start with us. Because if we understand the problem in a different way, we're going to explain it to the patient in a way that starts to destigmatize it. Where we fall short sometimes is just getting rushed in our day-to-day tasks and failing to recognize something really important, like the fact that somebody has an opioid use disorder. And at least from my perspective as a primary care physician, it doesn't always get the attention that it deserves. The other thing that I think is really important is to have some peer-to-peer support. And by that I mean, specifically primary care doctors helping other primary care doctors. Primary care doctors tend to be very pragmatic group, and they want to understand the problem, but they also want to know in a very straightforward way, okay, what do I do next? A little hand-holding goes a long way when you're asking people to address what can be a very complicated problem. I think the main complaint from most primary care providers within the VA is that, hey, PACT sounds great, but what I'm working with is not PACT, because we don't have a nurse on my team, or we don't have a clinical pharmacist to assist us, or we don't have a social worker. We need to have more people who want to make a career out of the VA, not just physicians, but nurses and schedulers and pharmacists and the like. What I'm seeing is that there's just a real, number one, lack of recognition of what opioid use disorder even is and how it's different from chronic pain. There's just not the same appreciation for addiction, opioid use disorder in particular, as a disease like it truly is. That, again, is no different than any of the other chronic medical problems that we treat. In missing these problems and not having the tools to treat it, it becomes an ever-present frustration, as opposed to an opportunity to feel like you're really able to be successful with your patients in managing such problems. I don't think we should ever take for granted the little things that we can say or that we can do that make a world of difference to our patients who have been stigmatized, in some cases their entire adult life,